Canada is set to see its millionth case of COVID-19 next week, according to the latest models released by Public Health, with the curve turning upwards again, driven partly by the spread of variants of COVID-19. Canada's top doctors highlighting the risk presented by these new variants, with data from Ontario showing increased transmissibility, increased hospitalization rates, and higher fatality rates.
There's 60% increase in risk of hospitalizations, 100% increase in admission to ICUs, 60% increase in the risk of death. And these severity indicators can be seen across all age groups of the adult population.
Dr. Theresa Tam was referring to as yet unreleased figures from Ontario's Science Advisory Table, showing how variants have affected Canada's most populous province. Since early March, Canada's R number, which shows how many new people one patient infects, has been above 1.
We can't let down our guard. The vaccination is rolling out. Certainly, it's on a good rhythm right now. But in the meantime, we need to hold on and really continue with the strict observance of the public health measures as well as individual practices.
However, Canada's vaccination program may be beginning to bear fruit, at least in the statistics. Incidence rates for people above 80 are lower than nearly any other group. However, this comes as people aged 20 to 39 are showing a higher incidence rate. Dr. Tam couldn't say if health officials have an estimated end date for the pandemic, saying case counts will decide that, but she adds that September is still the target for having all Canadians vaccinated.
I look towards a fall where you don't have to continuously put in restrictive measures. You're going to be able to go back into your social spaces, schools, universities, in a way that you can manage and not have to keep shut things down.
Now, if you're looking for a bright spot in that public health data, it lies with Canada's Indigenous communities. First Nations on reserve have brought the curve back down after seeing a winter spike, though the incidence rates for those communities remains higher than the general population. In Ottawa, Xiaoli Li, City News.